With the recent Medicaid funding cuts, hospitals are having to respond. Iowa's News 9 reporter Kaylee Whitlatch is in Washington with how one rural hospital is preparing for a potential new budget.
Rural hospitals say they could be hit the hardest with cuts to Medicaid, with potential changes to patient care, as critical programs could be on the chopping block.
Medicaid is essential not only for children and adults and people with disabilities and elderly. I mean, there's 3 nursing homes here in town. What's going to happen to this community?
Robin Plattenberger is a retired physician in Washington. She's been retired for about 8 years now, after serving Iowans for more than a decade and a half. She says it's already difficult to get a doctor's appointment in rural communities, and it could soon get even harder.
If you can imagine having 3% to cover any kind of emergency, failure of equipment, replacement of equipment, recruitment of lost staff, that kind of thing. So there's really no extra money in a hospital. And now you cut back what you've had and you just have no choice, cut service.
Washington Hospital and Clinic CEO Todd Patterson is not sharing exact examples, but he says the facility is considering plans that least impact its daily operations.
At some point in the future, as it's written, there probably will be fewer people that are on Medicaid, which will probably reduce the overall coverage. We are doing things like scenario planning, trying to figure out, if we can identify what these cuts are going to be long term, how we start absorbing those things now and do it in a way that is not detrimental to our patient care or our staff.
2 in 5 Iowans on Medicaid live in a rural area. Plattenberger says smaller towns already face challenges with medical care, and the new shift in Medicaid could make for even more difficulty reaching patients.
We're not recruiting young physicians here because, for one thing, the pay is less here in Iowa. Same thing with nurses. They can go to another state and make twice what they would here. So there are a lot of things that need to be addressed in order for our communities to thrive.
In Washington, Iowa, Kaylee Whitlatch reporting.